Hi everybody, Dr. Deed Harrison here with Chiropractic BioPhysics Seminars and Technique and Chiropractic BioPhysics Nonprofit. If you're watching these videos, you know that what we're doing is reviewing our peer-reviewed publications under the realm of CBP Nonprofit. In this session, I'm going to cover a brand new paper that just came out actually yesterday. If you're watching it, it's not yesterday for you, but it is yesterday for me. This came out in mid to late February of 2020. My good friend and chiropractor up in Gillette, Wyoming, Dr. Miles Fortner, spearheaded this case. It's out of his office. Dr. Miles actually presented this as part of his requirement for CBP Advanced certification. We require a case study, a case presentation at our annual conference, and it's got to be a case out of your practice where you walk us through the ins and outs and details of the case, whether it was successful or not successful, and what we can do and learn from this. This particular one was such a good case, good records, as you will see, that we wrote this up, and collectively as a team we got this in the peer-reviewed literature. The title of the paper is Cervical Lordosis Restoration for Late Whiplash Syndrome Alleviates Chronic Headaches 13 years after the motor vehicle collision. A CBP case report with a 1-year follow-up. Very important to discuss what we can do to help people with chronic or late whiplash injury syndromes, right? By myself, Dr. Miles Fortner, and Dr. Paul Oakley. This was published in the Journal of Contemporary Chiropractic in 2020, volume 3, pages 21 through 27. Now, Contemporary Chiropractic is a peer-reviewed journal that's been in existence for a few years now, spearheaded out of Parker University, and the editor-in-chief is none other than Dr. Dana Lawrence. Just real quick, the conclusions, we're going to put the cart before the horse this time, just to tell you, hey, you know what? The case is going to show a successful outcome by correcting the cervical lordosis with chiropractic biophysics methods in a late whiplash injury patient. Why does she have chronic whiplash 13 years following the injury still? Well, because she's got a cervical kyphosis that did not get corrected. Once it was corrected, it alleviated her chronic pain, disability, and suffering. This has huge impact for cases out there. Now, understandably, this is not a randomized trial. It's a case study, but when we have a chronic case with the history that we have and the documentation in this one, and then we intervene with something new, we get a proper evidence-based correction in the entity that we're trying to see, can we solve this problem, and then we see what the outcome is with validated questionnaires, and then we have a 1-year follow-up. To me, this supports a causal relationship. To begin, what is normal? Now, I'm not going to dive into this in detail. If this is your first presentation with me, then you're going to have some homework to do. I just want to give you a brief background. My group has modeled and developed normative data sets for what the sagittal plane cervical alignment should be. We should see a smooth rate of curvature that approximates a piece of a circle. So we know that the geometry should approximate a piece of a circle along the posterior vertebral body margins or the path of the posterior longitudinal ligament. Obviously over here is someone that does not have a smooth circular geometry for the alignment of the posterior vertebral body margins. My group, we started modeling this with my late father in the early 1990s, and we've continued to do this today. So our model represents a piece of a circle with a height divided by length ratio, and then we calculate clinically the absolute rotation angle or the total angle of curvature from C2 to C7, as well as the segmental relative rotation angles or juxtaposition adjacent vertebral segmental angles. The segmental angles should add up to the total angle. So when we do C2, okay, when we talk about biomechanical definitions of injury under rear end crash collisions, we've got to talk a little bit about what we call buckling mechanics. The mechanics of the cervical spine under motor vehicle acceleration, deceleration, impact events has been modeled quite extensively. I'm going to give you just a little bit of a background, and then I'm going to tell you the mechanics of this relative to changes in the cervical curve. First, if we look at the picture, let's say I'm an occupant, I'm sitting in a car, I'm in the driver's seat, so I'm parked, or not parked, but I'm stopped at a stop light. I've got my foot kind of on the brake, but not forcefully on the brake, and I don't notice the person behind me is not stopping. They're accelerating through the traffic light. They hit me. Well, they impact my vehicle. Okay, I'm in what's called the struck vehicle, and I'm being hit by what we call the bullet vehicle or the striking vehicle. Well, when I get hit from behind, there is some crumpling of, of course, my vehicle and their vehicle as it kind of absorbs some of the collision impact. However, my vehicle will be pushed forward. It will be accelerated forward, okay? When that occurs, because I'm seated in the car and on average my head is not touching the headrest, the moment of inertia of my head has not been overcome. My car starts sliding forward, which actually means my head stays still in space, but relative to the vehicle, my head is posteriorly translating. The vehicle is going forward that I'm sitting in, but my head actually has a net negative posterior translation. Also, because of the fact that my car seat is pushing my spine forward, my thoracic spine will flatten out. So my thoracic kyphosis starts to straighten out as my vehicle accelerates forward and the car seat is pushing on my back, my thoracic spine, my thoracic curve is straightening out. Then, because my car seat is tilted backwards on average 10 to 15 degrees, all chairs are, because I'm shifting forward like this, I'm making contact forcefully with my car seat, my rib cage tends to slide up the car seat. It's called the ramping effect. So I ramp up my car seat, my thoracic curve straightens out, my head is translated posterior relative to the rest of my body, and then because the torso is rising up, I compress the cervical spine in between the weight of the skull and the rising rib cage body mass. So shown here are the mechanics of what we would call it's not the vectors because there's no magnitude, but the direction of the forces that are being applied to my spine. We have compression and tension, and then we have bending moments. So we have force loads and we have rotational moments that are being applied. Well, my spine adopts an S configuration due to a couple things. Number one, the translation of the skull, but number two, the compression of the cervical spine between the weight of the head and the mass of the torso coming up. That creates what's called snap-through buckling, which means I shift the axis of rotation of my cervical vertebra on flexion and extension. The spine is rapidly compressed and translated, so I get this buckling effect where I get rapid change in flexion and extension, and I get some shearing going on. The consequence is abnormal loads are applied to this neck and it has an altered equilibrium position. And in fact, we've shown that this changes the cervical curvature. Now, what you're seeing here, this is the injury phase. This is not typically the injury phase. This right here is within the first 1 to 200 milliseconds of the crash event. And this is 2 to 3 times faster, sometimes 5 times faster than the muscular system can react. So when you get this S curve, it is not what we call a myofascial event. It is not a muscle contraction event. Muscles are not creating this. The consequence is I injure the tissues in the spine and I get an altered configuration of the cervical curve, and I will have a muscular contraction component to it as a net result, but not as a cause of what has occurred. If you have a kyphotic neck or a straight neck after a crash, you are more likely statistically to have a poor outcome, meaning you're going to suffer at long-term follow-up. That's what the literature shows. So now, with that background, we dive into our case. Miles in Gillette, Wyoming He's a great chiropractor, CBP chiropractor there. He was trained at Parker University, and then he started taking CBP courses early on in his student education. He became an exceptional CBP chiropractor. He's amazing. He runs a great office now in Wyoming. He had a new patient come to him that was a 29-year-old female, mother of 3. Her primary occupation is taking care of the household. She's an occupational household mother, manager of children. I mean, you know, we got to put this in perspective. This is a ton of work. If you don't think it is, dudes out there or women out there, I challenge you to step into a young mother's life and see if you can manage it for even a week. I'm living proof that I can't. So I can tell you that I like doing this a lot better. But you know, picture this, you know, mom trying to manage the house, you know, trying to manage the kids, trying to hold the kids, pick them up, care for them when they have young ones. She can't perform her occupational tasks because of her injury. She was rear-ended approximately 13 years ago at the age of 16 with an estimated rear-end impact speed at 35 miles an hour. That was the bullet vehicle that struck her. She was the restrained passenger inside of a Honda Accord. She was actually hit by a much larger vehicle according to the report. Following the accident, she had a significant, collision. Following the collision, she had a significant increase in headaches immediately afterwards, which is a red flag. If you get pain, headache, loss of consciousness, loss of memory within a few hours after the crash event, that's a high risk for future pain and impairment. She was diagnosed with severe whiplash at the ER. So she went to the ER, which is also a red flag. Anybody that goes to the ER within 24 to 48 hours after the crash collision, you know that they experienced likely a much greater acceleration and higher G-forces, and they have higher injuries. She then went to physical therapy and traditional chiropractic for 3 months. This did not improve her condition. She then sought out a second opinion at an orthopedic spine center in the Rocky Mountain, Wyoming area. And again, she was diagnosed with now chronic severe whiplash. There were no improvements in her headaches following that for 13 years. And this is documented in some of her exam records that were obtained, and this is verbally getting information from her. So if you can picture this, this young woman has suffered as a result of this for 13 years. She has chronic headaches as the primary complaint. Okay? Patient presentation, neck pain, on average a 5 out of 10. So that's moderate neck pain intensity. It jumps up at its severest to 8 out of 10, which is severe neck pain intensity. Her headaches are in fact worse. Her headaches are frequent, and they are frequently when they hit at 8 out of 10, meaning severe. They're associated with X-ray. She does not have anterior head translation, but lo and behold, we have a mid and upper cervical kyphosis. C2 is flexed on C3, C3 is flexed on C4, and C4 and C5 are relatively straight. The total ARA is 11 degrees, ideal is 42, minimum should be 20. So we want to see her at least in the 20 degree range. And if we look carefully down at the lower neck and upper thoracics, if you know what the PTSIA is, you can see that she is actually relatively normal within there from an eyeball perspective. So she should be able to actually get 25 to 40 degrees in her neck curve, okay? Because the PTSIA is within normal limits. If you don't know what that means, you got to watch the video presentation of me doing that. We have thoracic hypokyphosis, perhaps. So Dr. Miles recommended the following. Let's do 3 times a week for 12 weeks, totaling 36 sessions, but let's do new interventions. This is a chronic case, okay? We have a chronic case, we require x-rays, we have detailed exam findings. Let's now intervene to try to improve these issues that we see. Let's do corrective mirror image exercises using the prolordotic neck exerciser, which we'll show on the power plate. Power plate is whole body vibration. We can tighten up the core, we can get in a semi-squat position, we can activate 95% of your body's muscle mass when we're doing the exercise on the power plate, even though we're only doing neck movement, okay? We can do single leg stands. The x-ray on the dental, this is showing that, you know what, we're going to target the mid-cervical spine. Okay, I don't want to put too much curve down in the lower cervical spine. I want to target the mid-cervical spine. And if you remember what her neck x-ray looked like, this is a much better change in her cervical spine on the dental. So this tells me, A, I'm going to do the dental at home in the mid-cervical spine, but it also tells me that I need to do the mid-cervical spine in my angle of pull. Now when we do traction, we start at 3 minutes per session and we progress where we're working the patient over consecutive visits up to 15 to 20 minutes per session. So, wow, headache disability index, the emotional stress component of this. Imagine this, you've suffered for 13 years with chronic headaches and you cannot pick up your child. Can you imagine the emotional stress that is causing this young woman? And then people go, oh, well, it's all in your head. Come on, you know? Oh yeah, the people after a crash, it's only the psychosocial monetary gain. Really? She already got the settlement 2 years later. Why is she now at 52 out of 52 with her emotional distress? There's a problem with this. She didn't get the right type of care in the beginning, right? Down to 16 out of 52 following some care, and then at the final rehabilitation, end of program, end of corrective care, 36 sessions, she's down to a 2 out of 52. Wow. Just think about that for a minute. What is that like? The cervical spine improved 13 degrees. The segmental kyphosis reduced. Now her overall ARA is now within normal limits. She's in the 24-25 degree mark. This is very important. That's what we find out. When you get people into the mid-20s that have a normal PTSIA, they are going to improve. And then our case suggests that correcting the cervical lordosis by chiropractic biophysics methods in those with late chronic whiplash syndrome with cervical kyphosis or loss of the curve may alleviate the symptoms typically experienced by those suffering with late whiplash disorders. And the deal is, I'm showing this is out of Miles' office. What does this really mean? It means you have to step up to the plate and you actually have to do corrective care. You can't just call it corrective care and do whatever you want. You got to actually do something to correct the spine and correct the posture. You've got to show that you corrected it. You got to prove and verify it got corrected. You have to have the right equipment to do it. Then people will get better. That's why I show the picture of this equipment. You cannot just do traditional rehabilitation and expect the curve to change. You cannot just do traditional chiropractic adjusting and expect the curve to change on average. Now, once in a while, does it happen? Yeah. Once in a while, a blind squirrel finds a nut, you know, again, because they can smell. But you probably get run over by the car if you're a blind squirrel, so you're not gonna make it. You guys get it? Anyway, you gotta do corrective care. That's my version of the blind squirrel and the nut. End of the story, you know what, if you're a patient watching this out there, if you're watching this excerpt on the YouTube, you know what, let's look up a CBP trained provider. Go to cbppatient.com. If you've got chronic whiplash syndrome, let's find out if you're a candidate for the care that we do. If you have loss of your cervical curve, there's a damn good chance that this type of intervention will help you. I mean, the reality of it is, what do you got to lose, right? You know, what do you got to gain? Maybe getting your life back. That's what you've got to gain. If you're a chiropractor and you're just seeing this, come check us out. We need more quality chiropractors that are trained in chiropractic biophysics systems to be able to provide the proper care for patient populations out there suffering from abnormal spine and postural problems and suffering from chronic injuries like whiplash, crash collision injuries. Come to our seminars, get trained, do our Diplomate program. Check us out on idealspine.com. And then lastly, everybody, if you like what we're doing with the research, Help us out, support us. We're a self-funded private organization, and we try to put out good quality peer-reviewed publications. We've done everything from spine modeling studies to randomized trials to case studies, and we need your support. You can just support us indirectly through Amazon Smile by setting up Chiropractic BioPhysics Nonprofit as your nonprofit account under Amazon. Or you can support us directly on cbpnonprofit.com through donations. Thank you for your time and attention.